Timing of a retroviral therapy after diagnosis of cryptococcal meningitis. Definition: meningitis is an acute inflammation of the protective membranes covering the brain and the spinal cord, known collectively as meningitis. Meningitis can be life-threatening because inflammation is proximity to the brain and spinal cord. Therefore, the condition is classified as a medical emergency. Causes: meningitis usually results from a viral infection, but the cause may also be bacterial infection. Less commonly, a fungal infection may cause meningitis, because bacterial infections are the most serious and can be life-threatening. Identifying the source of infection is an important part of developing the treatment plan.
Viral meningitis is an infection occurring mostly in children under age 5. It happens when certain viruses invade the meninges, which are the tissues that cover and protect the brain and spinal cord. The meninges are arranged in 3 layers. The layer that actually touches the brain and spinal cord is called the pia mater. The spiderweb-like middle layer is called the arachnoid mater. The outermost and toughest layer is called the dura mater. Cerebrospinal fluid, which also protects the brain and spinal cord, flows between the meninges and over the surface of the brain. The most common cause of viral meningitis is a type of virus called enterovirus. Other viruses that can cause meningitis include the mumps virus, the measles virus, herpes viruses, and a variety of viruses spread by blood-feeding insects such as mosquitoes and ticks. Viruses that cause meningitis may be spread through the bite of an infected insect. However, the 2 most common ways the viruses spread are through fecal contamination, which can happen when hands are not washed after using the toilet or changing a diaper, and through contact with the body fluids from an infected person, such as through sneezing or coughing. Once inside the body, the viruses make copies of themselves and enter the bloodstream. Viruses travel through the bloodstream to the brain, where they cross the border between the bloodstream and the brain into the cerebrospinal fluid. The viruses spread throughout the cerebrospinal fluid and infect the cells of the meninges. The meninges become inflamed as the immune system begins to fight off the infection. Symptoms of viral meningitis in infants and young children include fever, irritability, loss of appetite, and trouble waking up. Symptoms in older children and adults include fever, headache, stiff neck, sensitivity to light, sleepiness, trouble waking up, nausea, vomiting, and loss of appetite. The symptoms of viral meningitis are similar to those of bacterial meningitis, but are usually less severe. Doctors may recommend acetaminophen or other non-steroidal anti-inflammatory drugs for fever and headache. For meningitis caused by a type of herpes virus, doctors may prescribe an antiviral medication such as acyclovir. There is no treatment for most viruses that cause meningitis, though most people recover on their own within 2 weeks.
Diagnosis: blood cultures. Blood drawn from a vein is sent to laboratory and placed in a special dish to see if it runs microscopic particulate bacteria. Imaging, X-rays, and computerized tomography scans of the head, chest, and cyanosis may reveal swelling or inflammation. Spinal tap, lumbar puncture. The definitive diagnosis of meningitis requires an analysis of your cerebrospinal fluid, which is collected during a procedure known as spinal tap.
This little girl lost her hands to bacterial meningitis. It can cause brain damage, even death. A major challenge for doctors is to find what type of bacteria is responsible quickly.
They'll use a broad spectrum antibiotic because they won't know what is actually causing the infection at that point. Then they would take a lumbar puncture, which is painful, but also if you take it from children or babies, the amount of sample that you can collect is going to be very small. And obviously you don't want to go back and take another lumbar puncture, so you want to get it right first time and get the information that you want, that you need.
So at the moment I'm pipetting some buffer in and then I'll pipette some DNA.
First, the tiny sample of DNA is amplified using an existing process. Then the new test, called CERS, takes over.
Essentially what you do is you shine a laser beam at a molecule and then you measure the shift in wavelength from the laser that you interrogated with.
To make the test much more sensitive, the sample is mixed with silver nanoparticles.
And we just turn on the laser beam and you can see that the laser is hitting the sample directly. You can see that nice scattering that you've got here. And all we do is we just run the sample and hopefully you'll be able to see the CERS peaks.
On the screen, 3 peaks, because the CERS test can find the fingerprints of more than one bacterium at a time.
The sample size is small, so you want to detect as many things as possible within that sample. The technique that we use has the ability to detect more within one sample.
That means treatment can be targeted. The researchers say CERS could be applied to any kind of pathogen that contains DNA, like fungi or viruses. Beating bacterial meningitis is just the beginning. Kenneth MacDonald, reporting Scotland, Glasgow.